The oncologist can be either called a medical or a radiation oncologist. So a medical oncologist focuses on any drug treatment really for any type of cancer, and that can be through from chemotherapy, immune therapy, it could be hormonal therapy, whereas a radiation oncologist focuses more on using radiation or X-rays to treat cancer. So within bladder cancer, why would someone come and see me? And that could be at various stages of when they're diagnosed. It could either be when they have very early or what's called superficial bladder cancer, and they might need some treatment into their bladder to try and prevent that cancer returning, or through to a more advanced cancer where they might need chemotherapy to help either reduce their chance of relapse or obviously helping them live as long as possible. So chemotherapy really refers to any drug treatment of any disease. In an oncology or cancer setting, it's talking about anti-cancer drugs, and are usually drugs that are designed to try and directly kill cancer if possible. And that can be used in a couple of different settings. So either it could be before surgery to try and either reduce the tumour size or reduce the chance down the track of the cancer coming back from cells that might have already escaped. It could be after surgery to try and mop up any cells that could be left behind. Or unfortunately, sometimes it's when the cancer's returned, and we might be giving chemotherapy to try and get that back under control to hopefully get people to live as long as possible. So intravesical means chemotherapy or drugs that are given directly into the bladder. That needs to be done by obviously getting into the bladder. You need to put a catheter in to get the medication in there. And there can be a number of different drugs used for that. So intravesical chemotherapy would be giving a chemo drug directly into the bladder to try and mop up anything that's left behind after a surgery and preventing little superficial cancers returning. Yeah, the mainstay, or the one that's kind of got the most evidence and is most effective, is a drug colloquially called BCG, because it's very hard to pronounce otherwise. Yeah. And that is actually giving a form of like a bug similar to what causes tuberculosis, but not the active infection. Mm-hmm. And the hope is that if you put a little bit of infection in the bladder, that stimulates someone's immune system to come and fight the bladder itself. And hopefully, if it's killing and fighting all the surface cells of the bladder, that the cancer cells are also fought as part of that. And it's hoped that if you can stimulate immunity to that long term, that maybe the patient's immune system will continue to fight any little cancers that come up down the track. We know that if someone has a reasonably high-grade or aggressive-looking tumour, that the chance of it coming back with no further treatment is quite high. And it might be up around 50% or so if we do nothing. And the hope is with giving something like BCG that maybe that approximately halves that chance of it coming back. And if it doesn't come back, it can't go on to get worse and invade because it's not there in the first place. So it's really not a guarantee that it won't come back, but it certainly reduces that chance. So because the treatment's given into the bladder and it's really trying to irritate the bladder and make it inflamed, is the symptoms predominantly are like getting a urinary tract infection or cystitis. So getting some burning or stinging when you pass urine, going to the toilet more frequently than you normally would, sometimes a little bit of lower abdominal pain or cramping. Very, very rarely, a little bit of the infection or the drug can be absorbed into the bloodstream and cause a temperature or even like flu-like symptoms from the immune effect in the rest of the body. But most of the symptoms are predominantly like a urine infection. We give it in the first phase when you've been first diagnosed. It's once a week for 6 weeks. And that's you come in, you have the catheter put in, the treatment stays in the bladder for approximately 2 hours, and people describe it as being on the rotisserie, where they basically lie on their back and every 15 minutes have to flip around to coat the whole bladder. And then the urine's passed and the drug goes out and people go home. That's initially done once a week for 6 weeks, and then another check cystoscopy to see if anything's returned. If everything's looking really good, there's actually further benefit in reducing anything coming back by having a maintenance program where approximately 3 to 6 months, you would come in and have another approximately 3 treatments of the same thing to try and further prevent anything returning. The side effects can be mitigated a couple of different ways, and one would be just drinking plenty of fluid to try and wash the medication through the bladder. If there's a lot of burning or stinging, simple things like taking Urale sachets or even having cranberry juice, things that people would often do for cystitis normally. If it becomes very severe crampy pain, sometimes we do need to use stronger painkillers or even have a break from the treatment to allow the bladder to calm down, the irritation to go away before we can restart. Through the treatment that goes directly into the bladder, there's very rarely nausea or side effects like traditional chemo. So there's no hair loss involved or anything like that. So the treatment sits inside the bladder and really very minimal amounts get into the rest of the body to cause those kind of traditional chemotherapy type side effects for that very early stage treatment.